Hello everyone, welcome back to my channel. Today's video, as you can see in the title, I am going to be talking to the parents of children who might be seeking therapy. For younger children and those preteen kids, teenagers, I did a video for them some months ago, but today's video is going to be geared towards parents of the younger children, so toddlers, adolescents, preteens, all those, that whole age range. So I'm just going to get right into it. No need to waste time. But before I do get into it, though, I will say that this is the information I'm going to provide to you is basically my process. Every therapist is different. Every practice is different. A lot of different, a lot of different practices do different things. And so this is solely for my clients, what I do with my clients. It's my process, but it is a general process. These are things that most therapists would do. Might not do it in the same order, or definitely not in the same exact way, but it is a generalized aspect of therapy. So first we're going to talk about what to expect upon, like, when you first inquire about therapy. So the first thing that the therapist or their admin might talk to you about, or should talk to you about, is insurance. They're going to ask you if you have insurance. If you don't have insurance, they're going to ask you if you're able to pay out of pocket, if you have a fee. Some therapy practices have like scholarships or sliding fee scales. It just depends on the practice and what they do and what they do allow. Now, there are many practices out there that and therapists that do not take insurance. What they will do is you will have to pay up front, but then you'll have to like battle it out, I call it, with your insurance company on the back end to get reimbursed, simply because it's a lot of work. People do not understand, if you don't work on the admin side, which I would have never known this before working in a practice that I work with now, that it's a lot that goes on with insurance companies, and they don't always pay on time, and it's a lot of behind the scenes type stuff. So in order to be able to focus on just therapy, some therapists don't want to have to hassle with insurance companies, so they will only take self-pay, no insurance. And so I just do want people to be aware of that, and do understand that should be one of the first things that you ask about. The next thing they're gonna ask you about is your availability. So, please know dates or time frames that you would be available. Sometimes therapists have preset times, or only times that they are available, which is my case. I have a full time, and I see clients with a private practice after hours. So I have a set time, evening hours, when I can see clients. So it could be a little difficult if you're like me to build a heavy caseload if you only have like 3 hours in the evening or per day to dedicate to therapy. So just be aware of that. So there might be limited ability in timing. So they're gonna then schedule a intake or a consultation, which is usually 15 minutes, free 15-minute consultation. Oh, well, I don't know if everybody's is free, but ours is, it's no cost. And that consultation call is to make sure that you guys are a good fit. The therapist and the client are a good fit. It's to make sure that the therapist can serve that family, making sure that they have the skills, the knowledge, making sure that it's their area. So for instance, for me, I work with children. Majority of my clients are young children and teens. So addiction, I wouldn't get a case of a person that has an addiction, or what else? I wouldn't necessarily treat adult domestic violence clients unless I absolutely have to. I have taken cases where it's just I have to take it on, but though that's the purpose of that consultation, is to get some more background about the client, about their situation, about what has happened in the past. So on that call, they're going to ask specific questions like what brings you to therapy, or what brings you to bring your child to therapy. They're going to ask you about when the behaviors start. They're going to ask you about how it impacts your day or the child's day. For instance, if your child has extreme behaviors that might be challenging to you, they're going to ask, okay, you know, like what parts of the day does it impact? Is it just at home, or is it at school, or is it in both places, multiple places? Because these are things that we need to know. They're going to ask, has there been any past traumas? Because a lot of times people may bring their kids and say, oh, I think my child has ADHD, when in fact your child has had some a bunch of traumatic experiences, and your child is just suffering from just plain old trauma. Or it could be both, but it's just a good idea for us to be able to know, so we also know ahead of time like how to treat any disorders, or treat any symptoms that that the child may be experiencing. Then we're going to ask about a history of mental health disorders, like do the parents have anybody in the family, any of those things, because those are also markers, or I won't say markers, but there are indicators that this could be the case for this child. Or also, I've had a case where a family had a child who had autism, and it was questioned if their younger child, this was the older child that had autism, but they questioned if the younger child had autism, when in fact the younger child was just displaying behaviors that they had seen from the older sibling. And after they got tested, they asked for my therapeutic opinion. Mine was just that it's clearly learned behaviors. They went, got the child tested, and that was exactly the case. It was learned behaviors. The child is not autistic. So that again is another reason why, not the main reason, but just an idea of why we ask these questions. We might ask, what things have you tried to help your child manage these behaviors, or to help your child manage any symptoms, because we don't want to try something that's already been tried and it doesn't work, or we don't want to, or maybe new ideas, things we'll know to present to you as a coping tool for the child and for the parent itself. We would ask, have your child seen a therapist before? And we're going to ask, what was the outcome? We're going to ask, how did they respond to the therapist? All those things. We're going to ask, why did it end, if they were once in therapy. I'm going to ask, I like to ask, what are your expectations? What are you expecting to get out of therapy? Or what changes are you expecting to see in your child? And what do you think my role is as a therapist? And what is your role as a client? Like I like to just kind of get information about what do they know about therapy, and how do they plan to show up. And then, I do tell them what my role is. I do tell them how I plan to show up during the sessions if we are a good fit. So then after that, if you are a good fit, then you guys will move into the scheduling. Normally for us, scheduling or the conversation about scheduling happens in that consultation call. So I'll ask, availability. I'll let them know my availability, and then I'll ask theirs. We'll also reconfirm about insurance information. That's the time that I'll talk to them about duration. I talk to them about confidentiality. I always talk about termination before, throughout the process, because that's what they teach us in social work, is that you're always talking about termination. And termination is ending services, because therapy is not meant to be long term unless you have a certain really a really major mental health disorder. Then it's not meant to be long term. And so I like for my clients to be prepared. So we do talk about termination. I do talk about how many sessions that I plan up front to have, but more sessions are always added. It can be added on the back end later. And that's just, again, they teach us in social work, the conversation about termination starts when that client walks in, or when you first start with that client. And it's not always it's never I'm gonna end on August 20th with you. It's more, like I said, of a, hey, therapy is not long term. This is what we plan. This is what I've planned. There's always space and room to increase time, all that stuff. We talk about duration. So normally I start right away with weekly sessions, especially with children, because I want to build trust with them, and consistency is the best way to build trust, is to see them, at a scheduled time back to back. So that's how that is. So then after that, you schedule, you come in for your first meeting. Normally for me, the first meeting is parent and child together, because we are doing, I call it a glance over. Like I'm watching the interaction between parent and child. There's certain things I'm looking for. There's certain keywords, certain things that help me to know what the relationship is, or help me to understand what the relationship could be between the parent and the child. Also, an assessment, or it's an intake form or an assessment that is done, and with both the parent and the child. Now, depending on the age of the child and the situation, sometimes I will collect the information separately. I might do it over the phone with the parent if it's a sensitive situation, or if there's information that's very sensitive, then I will talk to them or get that information on the phone. But if not, then I do it right there in the room. And it's a very in-depth that form is so long. It asks a bunch of questions. It's asking about your past history, the parent's past history, the child's past history. It's asking about birth. Like, was the child premature? Did the parent have a C-section, or was it a vaginal birth? They're asking about what else? Family dynamics. Do you have any siblings? Does the child have siblings? Where does the child fall in that birth order? Is there medication being taken? How much medication? Are there any allergies? We're asking about, have there been any hospital stays? Has there been any suicide attempts? Have there been any, just questions, criminal activity? Has the child stolen anything? Has the child been, convicted of a crime? Any of these things we are going in depth with. And we're asking about, do they take any drugs? Have they taken any drugs? Now, if I'm working with a teen, I'm going to revisit those questions when it's just me and the child. So I that's also another thing that I look for, is to make sure that stories or information correlates. So there have been many times where I'm sitting in a session with the parent and the child, and the parent, I'll ask, does the child smoke any weed or done any drugs, or sexually active? And the parent's like, no. Okay, great. I know, kids don't tell their parents everything. So when the parent leaves, I do go back and collect that information again, because halfway through the session, I like to, so sometimes the form is done in 2 to 3 sessions, just depending upon how much information parents and the child is giving me. Sometimes it can go by very quickly and it's done in 15, 20 minutes. Other times it really does take an hour or two. And so half of the session is, me and the parent, and then the parent and the child, and then I ask the parents to excuse themselves. And then it's just me and the child, and we're just talking, because I really want to know, do you want to be here? What are your real concerns? Because parents can have their own set of concerns, but then children can have the true issue that's going on already prepared. And so those questions, those sensitive questions, I might go back and ask the child, are you sexually active? Have you had any traumas? Any of those things. And I've had a couple times where the answers were different when it was just me and the child in the room, and they understand that confidentiality is a thing that I hold true. I stick to. So those are some of the things that are going on during that first session. Then the next session after that, which is, I call the true sessions. Those are, anything after that are the actual therapy sessions. And I always start with games. So each age group, I have a set routine, but everybody I do a little bit of play therapy with, or I play games with. So Uno is the #1 winner for children 5 and up. But the younger kids love blocks. My 3, 4, and 5-year-olds, they really do love blocks. and Play-Doh. So those are my two go-to things for them. But the first couple of sessions for the younger kids is really, all the sessions are me playing with them. I have an activity or a game of some sort. But the first couple of sessions is strictly just me playing games. Nothing, I don't ask any questions that lead up to why they are actually being in there or being seen. Because I don't want it to seem, I want it to be an authentic relationship. I want it to be smooth. I want them to feel comfortable with me. So the first couple of sessions is strictly us playing games together. And then after that, I'm asking questions. Every now and then I may have a situation where the child might allude to something. And so then I will lightly tread upon that, whatever the information is they provided during that playtime, to see, how they feel about expressing more or telling me more about the situation. But that's really just it. Now for my teens, it's a little bit different. But so first I'll tell you my curriculum or my routine. So for the younger kids, I do check in with the feelings chart, because kids don't always have the words or the language to express how they feel or what they felt that day. So I give them the smiley faces, and I let them choose, tell me how they feel at that moment. And then I'll ask them, hey, what was the best part of your day? What did you really like about your day? And then I ask, what was something that you didn't like about your day? And then that just helps me build rapport with them and let them know somebody cares about something that was hard or something that you really liked. And then we will read a book. A lot of times I have books that about building relationships. So This Is Me type of books, or if it's a child that's dealing with fear or anxiety, I do have those types of books. So we'll just kind of casually, I'll give them an option to pick out a bunch of books, or pick out one book amongst a bunch of books, and we'll go from there and we read that. And then after that, we play our game. So it's either building blocks, or we're doing matching games, or Play-Doh, feelings blocks, all these types of things. But I do make sure that we're playing blocks, I am imparting language about emotion. So, that's cool. Seems like that makes you happy. That makes you feel happy. Or if I'm playing a character that they give me, if I'm playing the little elephant, I'm just like, oh man, today is great. I feel happy, or I'm feeling not so happy, or I'm feeling sad, whatever. Just to start to build that language of and see what they know about emotions. So then I usually we'll end with a checkout, like, how are you feeling right now? Are there any lasting thoughts? Like, just something that'll kind of give us some type of closure for the day. And then, they go on with the parent. Now, if they are an older child, it's a little different. It's still check in, but it's like, hey, what was the most challenging part about your day? Or, and what was the best part of your day? And then we will do an activity, or we'll talk. A lot of times it's still building rapport. All the time it's building rapport. So I'm doing a all about me activity, like where I'm getting to know more about them. Or we'll play Would You Rather, or we're playing Uno or Connect Four, something like that. And then I let them journal or free draw. A lot of times kids choose a journal. So I have this thing where they have journals, they write in the journals, I keep the journals, and they do know that I do look at those journals. And sometimes I write back to them, sometimes I don't. I just let them kind of, just depending on the child and the need of the situation. And then sometimes anytime we can go off course of whatever my plan schedule is or plan curriculum is for that day for them, because it's all of this is child led. So it's their session. So sometimes I'm always just prepared, especially with my teens, because they can be so fickle. Sometimes they want to talk, and then there are other times where they're just like, I don't have nothing. Everything is fine. Everything is good. So if it is a day that they come in and they're like, oh, it was such a hard day or a long day, then we'll talk about it. Forget what I have planned, because it's more important. The whole idea is that we are able to converse. So I allow them to take over the session. We just talk, and then if there's time for journaling, we'll do it. If not, we don't. It's not mandatory. So then I also periodically do check in with the parents through email about behaviors, because we do know teens are teens, and they can come into a session and say everything is fine, and then you talk to the parent and the parent is like, everything is terrible. So I try to check in with them. Parents know that they can always freely email me and give me updates. I do respond as soon as I can. I do not go in and tell the session and like right away, hey, your parent said you skipped class, blah, blah, blah. It's more of a conversation of how's school going? Are your classes going? Are you going to class? But I do end up telling them, hey, I got an update from mom, so that they know that this is a community of people. Now, I don't go to tell the parents what they said, because my confidentiality is between me and the client, not the parent. But also I do, if parents say, please don't say anything, though, I do listen to the parents. I do take that into consideration, and I don't. But if they, don't request it, then I do, because I don't want the child or the client to feel like we're just to feel like, oh, you guys don't, it's just you two against me type thing. And that's not the case. I want to build community. So those are the things that you can look forward to if you are interested in therapy sessions for children, or getting your child some type of therapy. I want to say this, don't delay. If you feel like your child needs services, please do not delay. The earlier your child is seen or served, then the better off they will be in the long run. Early intervention is the best intervention. And so, especially if your child has experienced a traumatic event, get help right away. Don't wait, because it's just going to continue to build, and then other issues, they'll find other ways to kind of mitigate the pain, and we don't want that. We want them to be able to have healthy coping skills, and in order to do that, sometimes therapy is the better option. So so with that being said, these are all the things that you could look forward to if you sign your child up for therapy. If you love this video, like, comment, and subscribe. Send it to somebody you love. Let them know that therapy is okay for children. Everybody actually should have therapy, have had at least a check-in session, or a couple of sessions, because we go to the doctor to check up on our physical health. Let's check up on that mental health. All right, if you have questions, concerns, let me know. Comment down below. Give me some insight. Give me some input. Has your child or you experienced therapy? How did you like it? How did they like it? If you feel comfortable sharing, share it in the comments. Until next time, y'all, I'll see you later. Love you. Bye.